we just looked at my sort of therapy-based regime. We're obviously doing the hands-on part. But to make any sort of treatment regime relevant, we should really do some sort of a home-based regime as well. We can use some of the techniques at home. One thing, as I said, I've been using this cupping course, and I quite wholeheartedly recommend it because I'm starting to use these more and more, is the cupping device. And basically the patient, if he wants, he can put that on to his back where you have shown him, and pump the cup, and it will hold on. Now there are various ways of doing it. If one looks at this, you can see this blue thing inside. This, when we pull the skin up, can actually press on any sort of soft tissue and maybe activate the trigger points or deactivate the trigger points. But either way, the client can pump up. Obviously, there will be some bruising sometimes, not bruising, but the petracy, and treat themselves. They can do it quite easily by pumping it. And they can also release it by putting their hand round at the back and putting their finger underneath the cup and releasing it as such, and you can see the petracy there. Don't be too alarmed by those, they are quite normal. They pass very, very quickly. Another way we can treat trigger points is with a good old jack knobber. Very useful device. I love it simply because I can barely move, and it gets into all the little difficult places I can't get to. But one thing I have found, and I have started utilising it, as well as maybe treating some of the trigger points in quadratus lumborum or in the erector spinae, I can also use it to help myself with mobilisation with movements. So, for example, I will explain and teach the patient how to use these, and they may do a trigger point ischemic compression technique, pushing it in, holding it and releasing. Or they may want to try and do a similar sort of thing, but at the same time bend forwards and pull the jack knobber in at the same time and come back. And equally bend forwards and come back. I find this quite useful. There is another way of doing it, which is by using the belt, whereby the patient takes the belt, puts it around themselves, and just hold it with both hands like this. Just hold it with both hands, and they may then extend backwards whilst pulling forwards, and that will do the mobilisation with movement. But it's quite difficult to do a flexion type of mobilisation with movement with this, because as you bend forwards, and you're pulling, it might kind of just slide up or just basically flatten out. Whereas if I just relax off there, take the belt down, by using the jack knobber, you put it in, he can pull and bend forwards and get quite a nice amount of movement from that. And you may need to do it at different points. Obviously, this has to be done with instruction. So it's quite useful to do these things. They're a nice adjunct to our therapy-based treatments in the clinic, and very useful generally just for these sort of restriction and give type low back pain problems.